What I'm planning on covering in today's masterclass is, first of all, understanding why it is so difficult for us to maintain long-term monogamous relationships. People don't talk about that. They just talk about monogamous relationships as if they just are happily ever after, but they're complicated and they're hard. And we have to understand why that is so that we can then address it and move forward. And then I'm going to focus a little bit more on how you can maybe change your thinking and the way you approach your sex life to make it work better in your long-term monogamous relationship. And finally, what I'm going to do is actually give you very practical ideas for how to maintain this relationship, which I know everybody wants to do. Because when you have good sex in your long-term monogamous relationship, it changes the entire tenor of the relationship. It's fun, it's easier. I cannot tell you how many women have said something to me to the effect of, I come home at night and I find my partner's dirty socks on the floor. And if we've had good sex recently, I laugh and I scoop them up and I dump them in the hamper. But if we haven't had good sex, it just enrages me. And then I want to just stuff those socks down his throat. And so what I want to say to you is it is possible to maintain a long-term monogamous relationship. And I'm here to explain to you maybe why you're having a hard time, how some changes in your thinking could be significantly helpful, and also give you some very practical advice on how to make that happen. Hi, I'm Sheva Marcus. I am a sex therapist, and I work on that intersection between the physiological and the psychological. I'm really interested in what makes our bodies and our minds work together to get you the sex life that you want. I have 30 years of experience doing this. I'm in private practice, but for many years, I founded and ran one of the largest sexual health centers in the country for women. And we really pioneered this whole idea that when your sex life isn't working, it's because there are things that are getting in the way that maybe the relationship and maybe your feelings about your body, but more often than not, there's often also physiological things going on. The birth control pills that you're on, the pain that you may be having, the hormones aren't getting or should be getting. And when we can understand as a community of women that we can change and fix our sex lives by addressing this whole host of variables, it sort of changes the way that we approach sex. And so I'm passionate about giving women all the information they need to be able to take control of their sex life and make it better. I'm the author of Satisfaction Guaranteed, How to Have the Sex You've Always Wanted. It is a very practical, down-to-earth book on here are the problems that pop up for most women. How do you identify them? How do you figure out which problem is causing the other problems? Is it the pain that's causing the low desire? Or is it the low desire that's causing the pain? Is it the lack of orgasms that's creating the low desire? What is going on? It helps you identify that. And then it's very choose your own adventure. It gives you very concrete, practical advice on how to get past those problems. I really want women to be able to take hold of their sex life, understand their sex lives, and then fix their sex lives. So let's start with why it is difficult for people to stay in a monogamous relationship. And I feel like the first thing you need to really stop and think about is why you may be feeling like you're crazy because you're having trouble with this, or you're feeling shame because you're having trouble with this. You need to understand that is very normal. Most people in long-term monogamous relationships have a hard time. It is not uncommon for couples to either stop having sex entirely or to have relationships fall apart because they're not having sex. So the first thing I think you need to really understand is that your erotic brain needs to run wild and free. Your erotic brain does not do well when it gets bored, which is why often people have better sex early in relationships. And then when they think they should be completely focused on this current relationship and this current partner, which is one of the myths that we believe as we are in these long-term relationships, your erotic brain just gets bored and starts to shut down. And that is really not helpful because that makes you often not want to have sex. And one of the things I've come to understand over the years with my clients is that we think that women have an easier time with monogamy, right? We believe as a culture that women sort of do better with one partner than men do. And that somehow men are preset to want to have different women, lots of different women, many different women. That has been the narrative in our culture. And women are like really happy to settle down and be with one person and they're fine with it. Well, that turns out to be not true. And the data does not support that at all. As a matter of fact, when you look at the data, one of the things you find is that women's desire drops precipitously after a year or two in a relationship. And men's desire actually drops a little and then stays pretty consistent. And the question is, why is that? First of all, why do we have this absurd narrative in our society that women are fine with monogamy and men are the ones who have the roving eye? It is not helpful. But the other question is, why is it that women's desire collapse so precipitously? I'm going to tell you that in my experience with my clients, the reason for this difference is that women sort of do not understand that it's okay that their desire is going to drop and that they can use other outlets to keep their desire going. So for example, a man might start finding that his desire is dropping, but he naturally will maybe start noticing other women or fantasizing or watching erotica. And he feels like that's fine. And that keeps his desire at a sort of good rate and it's humming along. And he then will have energy and sexual energy to have sex with his partner, his wife. Women somehow feel like, oh my God, if I'm fantasizing about the fireman up the block, or if I'm fantasizing about this coworker or the Duke off of Bridgerton, there must be something seriously not okay with me and my relationship. And so they just shut it down. My experience is they just shut down their desire. And as soon as women start to understand that it's perfectly normal and natural and actually even healthy to allow your erotic brain to explore and think, and that what you're fantasizing is not reality, and that is so normal and common, it opens up the entire erotic world, and that allows her to be sexual with her partner. Like, I feel like men start feeling like they need to be thinking about other things, and they do it, and then they're really happy to go home and have sex with the person that they love, that they're choosing to have sex with. But women somehow shut down the erotic part of their brain because they feel so guilty about their fantasies or what they're thinking about or what they think they're supposed to be thinking about. And so they just shut down their erotic side altogether. And they have this precipitous drop in their desire for sex and their interest in maintaining sex. So I think one of the things that we need to talk to each other about as we head into this journey is our very unrealistic and over-romanticized views about what our sex life long-term should look like. And what happens when you have these romanticized views is that you keep falling short and you think that there's something wrong with you. And you think that if you're not interested in sex, that's because something's a problem in the relationship. And if you walk through your life feeling like you're not having sex because there's a problem in the relationship, then there will be problems in the relationship. Always talking to clients about this. I have clients who've spent years in couples therapy. They aren't having sex. They think their relationship's pretty good, but the therapists keep telling them, well, if you get your communication up and running, then the sex will follow. And that is just not the case. You can have excellent, wonderful communication with your partner and still not be having a good sex life with them. As a matter of fact, the bad sex life may actually create problems in your relationship. So this narrative that we have as a community that if you have a good relationship, then therefore, ergo, it follows that you will have good sex is just not true. And I want to add to that if you have a good sex life, it can actually positively affect your marriage and your relationship and your long-term monogamous relationship. So we have this really weird, we've all sort of over-romanticized this weird view of relationships and how they run one way, right? If you're feeling close, if you're feeling comfortable, if you're feeling like you communicate, then you definitely have good sex, right? And we somehow privilege the talking and that verbal communication over the physical and the touching communication. If we can get the sex life on track, I can't tell you how often that's actually been a healing part of a relationship. And it can get our relationships back on track when you feel close and connected to somebody. So I think we need to start thinking about our monogamous sex lives a little bit differently. And now this is going to be mind-blowing for so many of you who are watching this. So much of what's happening in our life physically can have an impact on our desire for sex, on the way that we have sex. And we just ignore it. The birth control pills that we're on, the high blood pressure medication that we're on, the medications that our partners may be on, when our back goes out, when we're feeling bad about our body physically, when we hit perimenopause and menopause and our hormones are off, those have huge, significant impacts on your feeling sexual and your being sexual and on your ability to have sex in your life. And for us to then assume your hormones dropped and you're not interested in sex, but to us assume that there's a problem in the relationship and that's not why you want to have sex, or you're bored with your partner and that's not why you want to have sex, that is not a helpful process. It is a much more helpful process to be able to sort of separate out the strands and try to understand how multivariable and how complicated your long-term monogamous sex life is, and understand that your physical changes, you're early on, you're having pain, that's going to have a piece of it. The kids banging on the door are going to have a piece of it. Losing a loved one, that's going to have a piece of it. Your crazy work schedule is going to be a piece of it. Your crazy partner's work schedule is a piece of it. You're going on medication that then affects anti-anxiety medication that then affects your libido. That's going to be a part of it. There are so many pieces that we need to be so much more sophisticated in understanding how these variables affect our long-term monogamous relationship. And once we do, everything is treatable and everything is fixable.